Assalamu alaikum everyone. Welcome to my YouTube channel Medivale Pro. I hope you guys will be fine and doing great and enjoying your good lives. Okay, so now we are going to start our next lecture. This is going to be the lecture number 2 in the medical billing interview preparation quiz series 2024. Okay, so this is going to be the insurance verification. So what kind of a questions, what kind of a answers, and what kind of a interview kind of a questions will be asked while you interview. So we are going to review all those kind of a questions in today's lecture. So we are just going to have 10 questions regarding insurance verification. So these questions could be very crucial for you guys. So this is the lecture number 2. Okay, so we have already uploaded the quiz series lecture number 1 on my YouTube channel. You can just go through that one. These questions are going to be for the fresher ones. So if you are fresh and you want to get the job in medical billing department, okay, so then you need to learn and you need to memorize all these kind of questions. Okay, so the first lecture was all about the patient registration. So what kind of questions could be asked while you interview regarding the patient registration. So that was the lecture number 1. You can just go through lecture. Okay, so now we are just going to cover the second lecture, that is the insurance verification. Okay, so what kind of questions could be possible in your interview. So the agenda is going to be here are 10 multiple choice questions with answers related to the insurance verification in medical billing. So this is going to be the lecture number 2, and that is going to be all about the insurance verification. So we will see that what kind of questions can be asked while you interview regarding insurance verification. So let's start the lecture and let's see what is the question number 1. Okay, so the question number 1 is going to be the why is insurance verification important in medical billing? Okay, you guys know that that is quite important. Why it is important? So let's see that. So question number 1's answer A is going to be the to confirm patient's identity. B, to ensure that services will be paid for by the insurance company. To determine the patient's medical history. To assign a healthcare provider to the patient. Okay, so what would be the quite possibility reason that we are going to verify the insurance verification? Okay, so is the patient is eligible, is the patient is going to be active on date of service with some sort of insurance or not? So why it is important? So what do you think? You can just provide me the answer, but I'm going to also show the answer to you guys, but you guys need to think about this one. So these are the 4 possible questions. So what would be the answer? So the answer is going to be this one. The answer is B, to ensure that services will be paid for by the insurance company, like the services which were rendered by the rendering provider. Okay, so these services will be just sent in a claim to an insurance company, and the insurance company is going to pay for those kind of services. So that is a basic reason that we are going to verify the insurance verification. Okay, so this was the answer of the question number 1. Let's see what is the question number 2. Okay, so which of the following is typically verified during insurance verification? जब पेशेंट की जब इंश्योरेंस की वेरिफिकेशन की जा रही होती है, सो मीन्स ये कि क्या चीज़ें होती हैं जिसको हमने वेरीफाई करना होता है? पेशेंट्स एम्प्लॉयमेंट हिस्ट्री, आर वी गोइंग टू चेक लाइक to whom for that kind of employer the patient is going to work for, insurance policy number and coverage, patient's education level, patient's next to kin. Okay, so what do you think about this one? Okay, so the answer is going to be the option B. Okay, so insurance policy number and coverage. Yes, we are going to see that what is the insurance name. Okay, what are their ID? Okay, and if the patient is active on date of service with them or not. If the patient is active, then the patient is like verified and eligible for that kind of a service. And if the patient is inactive, then we need to let the patient know that you are inactive with the insurance and you need to provide us the updated information if you have. Otherwise we are going to bill that kind of a services for you to you. Okay, and you need to pay all that kind of a stuff or bills out of your pocket. Okay, so let's see what is the question number 3. So the question number 3 is going to be the what should be done if a patient's insurance coverage is found to be inactive. Okay, so that question can be arise or asked while you interview कि हाँ भी जब पेशेंट की जो इंश्योरेंस की इंफॉर्मेशन होती है हम जब वेरीफाई करते हैं उसके अंदर अगर पेशेंट इनएक्टिव हो जाता है तो उसके बाद नेक्स्ट स्टेप क्या होता है? सो उसके बाद क्या करना होता है? प्रोसीड विद द ट्रीटमेंट एंड बिल द पेशेंट लेटर. ठीक है, आप मुझे जो ट्रीटमेंट करना है वो ट्रीटमेंट करें, उसके बाद ये कि पेशेंट को बिल कर दें. इन्फॉर्म द पेशेंट एंड डिस्कस पेमेंट ऑप्शंस. कैंसिल द पेशेंट्स अपॉइंटमेंट. रजिस्टर द पेशेंट विदाउट इंश्योरेंस. सो व्हाट कुड बी द आंसर ऑफ दिस वन? So I guess the answer of this one is going to be the inform the patient and discuss the payment options. Okay, patient को हमने inform करना होता है that your insurance is inactive on the date of service. Okay, so you are inactive with that kind of insurance and we are just going to let you know about this one and we will discuss the payment options, so how you are going to pay for the services. Okay, so that is the question number 4. Now we are just moving to the question number 5. So what information is essential for completing insurance verification? Okay, so what kind of information is essential to complete the verification of insurance? So the question option A is going to be the patient's demographic information, insurance policy number and group number, patient's medical history, patient's preferred pharmacy. Okay, so what would be the answer of this one? So if you know, you can just comment on this one. Okay, but I'm also going to provide the answer. But I guess once we are moving to the next slide, then you can just imagine that what would be the answer of this one. You should have the answer in your mind. Okay, so let's see what is the answer of this question. Okay, so the answer is option B, insurance policy number and group number. Okay, we are going to collect this information like what is the insurance name, insurance policy number, and the group number as well. Okay, so the next question is going to be the question number 6. How can verification errors impact the billing process? Okay, so interviewer can ask you like how can verification errors impact the billing process? Okay, so what are the consequences if the verification is not completed accurately? It speeds up the claim processing, lead to claim denials or delays, improve patient satisfaction, increase revenue. So what would be the answer? Actually, that is quite easy question. Okay, so you can see that lead to the claim denials or delays. Okay, so if the claim is having incorrect data regarding the patient registration, insurance verification, then we need to collect the accurate data. Then we need to submit the claim to the concerned insurance. Okay, so on which the patient is active with that kind of insurance, rather than the that kind of insurance on which date of service the patient is inactive with them. Okay, so the answer is going to be the option B, lead to claim denials or delays. Okay, so in this way you guys can just collect the accurate data. If you are going to collect the data, then then the insurance is not going to deny your claim, and insurance is going to adjudicate your claim and provide you the payments or reimburse the payments for the services which were rendered by the rendering provider. Question number 7 is going to be the which department is typically responsible for verifying a patient's insurance coverage. Okay, so who are responsible to collect the patient's information and who are going to verify the eligibility for that kind of a patient? Clinical department, registration or billing department, human resource department, or legal department? So what do you think? What would be the answer of this one? Okay, so the answer is going to be the option B. Okay, so registration or billing department. Okay, so the billing, most of the time registration, while doing registration, the registration staff verify the eligibility of that patient. Okay, so and if the patient is inactive on that your service, then we are just going to inform that patient that you are inactive with this insurance and we need to discuss the payment option, so how we are going to proceed with the payments. Okay, so the billing department is going to verify the eligibility of that kind of a patient. So the option B is going to be the correct one. Next, we are going to see that what is a potential consequence of failing to verify insurance coverage. Okay, so what is the potential consequence? Okay, so enhanced patient care, higher approval rates for claims, unpaid claims, and financial losses, or faster billing process. You guys know that what would be the consequences if you are not going to collect the accurate information and you are submitting the claims with incorrect information? Then there would be unpaid claims and financial losses. So the answer is going to be the C. Okay, unpaid claims and financial losses would be the result or would be the consequences if you are going to collect the incorrect information and if you are not going to get the eligibility or not going to verify the insurance. Okay, so next see what we have. Okay, so the question number 9 is going to be the which of the following might be an indication that insurance verification was not completed properly. Okay, so what should be the consequences or what should be the indication? So quick payment from the insurance company, increased patient satisfaction, high rate of claim denials, lower patient registration times. So I guess the question C is going to be the correct one, that is high rate of claim denials. Yes, if you're not going to collect the insurance information correctly and you are not going to submit the claims with the correct information, then you are just having the high rate of claim denials, and that is the indication that you are not going to get the insurance information correctly. Okay, so the last question of today's insurance verification step is going to be the why is that important to verify the insurance coverage before providing services. Okay, so why it is important? So you guys need to verify the patient's eligibility and verify that is the patient is active with that kind of insurance or not. So what is the possible reason? So the answers are going to be option A is to confirm patient's identity. Option B is to ensure that the insurance will cover the services. Option C is to make sure that the patient arrives on time. Option D is going to be the to update patients' medical records? So what is the answer of this question? So the answer of this question is going to be very legit and very accurate. So that is the option B, to ensure that the insurance will cover the services. Okay, so if you are going to collect the insurance information and you are verifying that insurance information at the time of registration, okay, so that is the main reason that you guys want to get the reimbursement for the services which were rendered by a provider. So if you collect the information of that insurance company, then you guys need to know like what in that kind of a sense that insurance is going to pay for those kind of a services. So for that kind of a reason, we are going to collect the correct information and updated information of that patient. Okay, so that was the answer of the 10th question. Okay, so thank you so much for your attention. So this was all about the lecture number 2 about the insurance verification, what kind of things are required, or why we are just going to collect the insurance information, and why we are going to verify the patient's insurance verification. Okay, so all that kind of stuff we have just covered today. So you guys need to memorize these questions before your interview. Okay, so you guys, if you guys want me to contact, then you guys can see my contact number, that is the WhatsApp number, and you guys can also email me on my email address as well. Okay, so inshallah we'll meet in the next lecture with different kind of a stuff in medical billing. Okay, so if you guys have any kind of questions in your mind regarding patient registration or insurance verification or any other kind of a process in medical billing, then you guys can let me know. Okay, so thank you so much once again. Take care of yourself and your family, and do remember me in your kind prayers. Take care. Allah Hafiz. Goodbye.